Hi everybody, my name is Dr. Chua. I'm a Singapore laser surgery and aesthetic doctor. Today we'll be talking about the topic of melasma. Pigmentation is a big problem in the Asian populations by virtue of our darker skin, which has more factories that produce this melanin that causes brown pigments or even darker pigments. So when Asian skin and skin type that's a bit darker gets injured, it has more propensity to darken. Unlike Caucasian skin, which frequently heals without a mark left even after injuries. The advantage of these pigment cells is that they actually protect our skin from harmful UV rays, hence we have lower rates of skin cancer, and also we tend to look younger than our Caucasian counterparts. The trade-off, however, is that pigmentation conditions such as melasma can happen more easily, which can make the face look patchy or even a little bit dirty. So I've actually lectured extensively locally as well as overseas on this topic, and it's always a topic that gets doctors excited over, whether melasma can be treated reliably, consistently, or even be cured. This topic strikes so much fear in doctors sometimes that I've even heard of experts who recommend that treatment should be geared towards just preventing the worsening and cannot consistently improve the condition. I've also heard of experts who blindly recommend to trial and error different options to see which works the best for this particular condition. I think it's understandable why so many doctors are fearful of this condition, because over the years we've had many patients come from treatments elsewhere that either don't improve or have their conditions worsen even while treating the melasma. I think it comes down to a few factors. I'm just going to name 3 factors today that contribute to this non-improvement and also worsening of their condition. Okay, the first issue is actually incomplete treatment of the various contributing factors. Because melasma is not caused by a single factor, it's usually a complex combination of their lifestyle as well as genetic factors. So there are different modifiable and non-modifiable risk factors involved, which can require different advice. One simple but important example would be the influence of hormones on melasma. And if actually the treatment has not even factored in the influence of hormones on your condition, it's likely that you are going to get incomplete and hence poor results from your treatment. The second biggest issue that I've noticed is the poor use of lasers as well as chemical peels in treating melasma. As you probably know, lasers and chemical peels can be effective treatment for melasma. Unfortunately, as I mentioned earlier, when skin gets injured, the pigmentary condition can actually worsen. And this is what we've noticed with a lot of treatments out there. Treatments that are too harsh, eager to see results, frequently cause damage by worsening melasma. One example would actually be a certain pico laser craze that was going on earlier that was subsequently found in a study by the National Skin Centre not to have good effect on melasma. And unfortunately, it's all these crazes of new technology in the hope that it can treat conditions much better, but without actually really delivering the results. Don't get me wrong, I'm a huge fan of picosecond lasers, but they need to be the correct type of picosecond lasers and they need to be used properly. The last issue I've noticed is that of poor post-care after the treatment. And I find that a lot of people are not actually being given dedicated skincare advice after they've received the treatment. So you've prepared for the treatment, you've done the treatment, and that has been a lot of time and cost. And there should be proper post-care after that. And it's not just simple sunblock use. It can involve various things actually, lifestyle modifications, as I mentioned earlier, hormonal checks, and as well as, of course, other types of skincare. So I hope with this analysis you understand more about your condition of melasma and how difficult it can be to treat it without the proper strategies. And it's with this also that we are able to consistently and reliably provide results to patients with melasma, and even in cases, sometimes curing them from their condition. Don't lose hope if you have had this condition or if you have had it worsen with treatment. Melasma can be treated reliably and consistently and even cured in certain cases. Thank you for watching. Feel free to leave us a comment or reach out to us directly if you have any questions.